Welcome to You and Your Health. I'm your host, Dr. David Bertone. Today, we're going to have a unique topic on integrative and functional medicine. People are now looking at alternative healthcare solutions for common problems that have been traditionally treated with Western medicine, and now there's a way to integrate some new and exciting concepts utilizing integrative and functional medicine. Our guest today is Dr. Robyn Del Negro. Dr. Del Negro is a board-certified physician with a fellowship in integrative medicine. Her practice, Del Negro Integrative Healthcare, is based in Red Bank, and she's going to talk to us today about integrative and functional medicine, and particularly how her practice can help with common problems. Dr. Del Negro, welcome to the show.
Thank you so much, and thanks for your interest. I really appreciate it.
So tell us how you got involved in this type of medicine.
So I am a traditionally, conventionally trained MD, and have been practicing for about 30 years, hospital-based. I am board certified in physical medicine and rehabilitation, and that was my first love. What's interesting about rehab medicine is it's a little bit of everything. It's a combination of internal medicine, neurology, musculoskeletal, but also functional, right? The functional things that you need to do on a daily basis. What got me interested was I could have two patients that both had a stroke in the hospital with me in bed A and bed B. They had similar ages, similar sex, same sex, same risk factors for stroke. But what I noticed was they each had sort of this intangible, I want to call intangible health qualities. For example, these were not the things that I was taught in medical school. Family connection, purpose, spirituality, and I don't necessarily mean just organized religion, but something above them, and relationships, being connected. And I noticed that people healed differently based on some of these things. For example, bed B, who had a stroke and was paralyzed on one side, was the primary breadwinner in the family, right? Now he couldn't go back to the job that he had. So now we had this undue socioeconomic financial stressor that affected how he healed. Bed A had this incredible purpose where twice a week he cared for his daughter's children so that his daughter went to work. That person had this incredible motivation to get better. He had a purpose. I like to say spirituality. Now, I will tell you that people that have faith, that do have an organized religion, that they do follow, I will see that they have decisions that they have left up to God. So they're not struggling so much there's not this emotional burden. All of those intangibles helped people heal. So I was thinking, I need to know a little bit more about the intangibles. So I had an opportunity to go back to school. I completed a post-MD fellowship with Dr. Andrew Weil. He does a integrative medicine fellowship. It was so eye-opening for me and life-altering for me personally. So not only did we talk about mind-body, we talked about the stress response, we talked about in the healing in the context of what was going on in the person's life. And a huge thing that I learned nothing about in medical school, which will be shocking to you, is nutrition. We spent, 2 classes, maybe 2 hours in 4 years of training, and then 4 years of residency talking about nutrition. And so for me, that was huge to understand that food is actually medicine.
Yeah, and I think that's a good point regarding this topic, is people or physicians or medical doctors are typically geared in the pharmaceutical model. And
Correct.
this integrative model is looking more at the nutritional component and mind body, and how can you use
Correct.
these other things to get to the same solutions.
Correct.
Okay.
Correct.
So now that's one difference in the approach to traditional medicine or medical management. Is there any other differences that are pretty obvious for people?
Okay, so something that I like to explain to my patients if they're new to this field
Hmm.
is we talk about a tree. Functional medicine uses this analogy all the time. We talk about a tree, the root system, the trunk, and the leaves. So if I equate the leaves to symptoms, so that could be I'm having GI bloating and discomfort, my bowel movements have changed, I am sleeping less, I'm waking up not refreshed, I'm noticing cardiac, heart palpitations. Those are the leaves. That's what brings you to the doctor.
Hmm.
Those are the symptoms that bring you to the doctor. Conventional medicine has siloed itself. So you go to the cardiologist because you felt heart palpitations. You went to the GI doctor or gastrointestinal doctor because now you're having abdominal bloating. Functional and integrative medicine takes a couple of steps back, looking at the soil that your tree is growing in, looking at your root system. I'm looking at how much sun did you get? Was your dirt that you were buried in full of nutrients, or was it not that dense? So we kind of look at it backwards, if that makes any sense. I'm
Hmm.
not starting at the symptoms. I'm looking at your the sort of digging deeper, I guess, actually,
Hmm.
to see the root system and to see what you've been planted in. Now, that also includes some DNA, right?
Yeah.
Because we all come to the table um, with things that were given to us in our DNA. So I need to look at those. I don't want it to be DNA is not your destiny. So when people say to me, I'm diabetic because my dad was diabetic and my grandfather was diabetic, I just want to know that there was diabetes in the family.
Mhm.
But I don't want you to think that we can't change something lifestyle wise, nutrition wise, so that you don't actually come down with diabetes.
Got it. So you talked a little bit about the importance of past family history.
Mm-hmm.
When you see a patient for the first time, what is a typical workup for a new patient? Besides that, what are some of the things that you're going to do to help establish
Um, so I have to tell you, my ideal patient is somebody who has come in committed to making some changes for their health. So I start by sort of letting people know you didn't get here overnight. You didn't get this way overnight. And we're not going to be changing it with just one visit to me, right? I mean, just one visit. Assuming that somebody is committed to making some changes, and I have to tell you, lifestyle changes are way harder than
it?
taking a blood pressure pill.
Yep.
um, I get this crazy health history that takes a very long time for patients to do. I want them to take their time with it. I want them to be mindful. It's not a typical doctor's visit. This is not an in and out 20 minutes. I'm asking people to send me this incredible intake, which takes about 2 hours to fill out. That gives me an unbelievable history or sort of a health story. It almost gives me their health story in terms of things from before they were born, even I'm asking about.
It's
And
like a
then
health family tree, right? It's like a health
it's like
family
a health family tree.
tree. Yeah.
And then I'm also asking them to be honest. I want them to take an honest look at their health story. The more information I get, the better. We spend almost 2 hours together, our very first meeting, where we fill in the blanks. So I have sort of an understanding of their health story, but then I need to fill in the blanks. And so it's very collaborative. I mean, it's very much it's a collaborative approach. So
Yeah, do
people
you,
come,
after that and getting all that information,
Mhm.
is there a special like nutritional analysis or blood work or special tests you would typically
Yeah,
do to
so
get a
I
baseline?
ask my patients to send me whatever conventional labs they've had done in the last year. So that's generally what you would get when you go to your primary care physician, right? You're having your CBC checked, maybe your blood sugars checked, they're looking at your total cholesterol. So I want to see all of that because that does give me some indications. But here in integrative medicine, we have access to this amazing battery of specialized testing. And by this, I mean, you know, um, I may want to know what your adrenal glands are doing in terms of your stress response, right? You may say to me, oh my God, I am under so much pressure. Not only am I caring for my own kids, but I'm caring for my aging parents. And I'm running ragged on both ends, plus I'm working. So I will do salivary stress testing so that I can actually see what their adrenal glands are communicating with the rest of the body. One of the ones that I really like is something called the NutriVal. It's done by a lab called Genova, and that actually looks at the actual foods that you're eating and the high quality food, hopefully what quality are the foods that you're eating and how those foods actually help break down and drive all the reactions going on in the body. So for example, if you remember your 12th grade biology when you talked about the powerhouse of the cell, the mitochondria, we know that in order to make energy in our body, those mitochondria need to be given cofactors. And the cofactors come from real food. The vitamin Bs that you get from the green vegetables that you're eating, or the antioxidants that you're bringing into your system from the citrus foods that you're eating. So this actually tells me specifically what nutrients you're lacking that we can either add in your diet or supplement you with.
That's
So
obviously something that you would never get in a traditional
you would never
primary medical
no,
doctor.
you would
So
not. Yeah.
this concept is truly unique. And
Yeah.
when we come back after break, we're going to talk specifically about some of the common problems and how you address them
Sure.
utilizing integrative and functional medicine.
Perfect.
So we'll be back in just a second.
The COVID-19 vaccines can be our chance to get back to our plans, to get back to each other, to life. But it's okay to have questions, like, how were the vaccines tested? In rigorous clinical trials among adults of diverse backgrounds. Find the latest information at getvaccineanswers.org.
Hi, welcome back to You and Your Health. I'm your host, Dr. David Bertone. Today, our guest is Dr. Robyn Del Negro. Dr. Del Negro is a board-certified physician specializing in integrative and functional medicine, and her practice, Del Negro Integrative Healthcare, is in Red Bank. Dr. Del Negro, thanks again for joining us.
Thank you.
So we before the break, we were talking in general about integrative and functional medicine.
Sure.
Let's talk about some of the common problems that you see in the practice and how you treat them differently than traditional medicine. Big one is diabetes. Let's start with that.
So I generally will see patients who have been diagnosed with diabetes type 2, which means that their insulin is still being produced by the pancreas, which sets them apart from diabetes type 1, where their pancreas doesn't produce insulin. So diabetes type 2, we normally see it in a spectrum of other types of ailments. So I'll see this in a patient who is carrying a little bit of extra weight around their belly, which is sort of new for them. They may have something called metabolic syndrome, which is this kind of constellation of, their insulin's there, but it's not quite doing its job as effectively as it used to. Sometimes we'll see with that an elevated BMI or body mass index. We'll see sometimes a higher cholesterol in these patients. We can see some elevated liver enzymes, and they're kind of on this spectrum of, just things need to be tweaked, and the body is kind of shouting, help, we need to tweak something. So yes, sometimes our patients need to get started on a conventional pharmaceutical, which is not an issue. Sometimes their blood sugars are so high
Mhm.
that we need to kind of bring them down. But a lot of my patients just have this new diagnosis and they want to know, what else can I do? So your conventional doc is saying, lose weight, eat better food, and move. But they don't really give you the specifics for that. So we try to do things with both botanical herbs. So I will tell you, for example, berberine is an herb that's been around forever, and we see that it stabilizes blood sugars.
Oh, okay.
Yeah, there's a whole bunch of them that we try to introduce. We also spend a lot of time talking about real foods, real nutrient dense foods. And I always tell, again, I mentioned it before, food is information, food is medicine. And sometimes just by educating people as to what is a nutrient dense type of food, we can really change things. And yes, movement's essential. Movement is essential. Stress management, we do a lot with stress management. And all of those things kind of put together really make a huge impact.
So you're gonna give them more of the specifics on what to eat and how to
Correct.
exercise and how to reduce stress than just saying, go
Correct.
lose weight and move. So
Right. It's
it takes
really about controlling, making sure your insulin can respond appropriately. And we sort of show you how you can get your insulin to do
Got
its
it.
job better.
Okay.
Yeah.
Another big one that you see is patients with hormonal imbalances. Can you
Correct.
explain that and how do you deal with that issue?
So in functional and integrative medicine, one of the first things that I was taught was you're going to see a lot of people around that a lot of women and men around that sort of middle age where they feel like they're either in perimenopause, meaning the years before menopause, where your ovaries stop producing its own estrogen and progesterone. And even for men, sort of, we talk about it as menopause, even when some of your testosterone levels may be sort of declining a little bit. Patients will come in looking for hormone replacement. That's what they want. They want bioidentical hormones. We were taught in functional medicine that I can give you tons and tons and tons and tons of hormone replacement, but unless I fix your adrenal glands and your thyroid and the mind-body connection with all of those hormones, it's never going to be balanced. Our body's communication system is your hormones, and they essentially spend all their time talking to each other. Your thyroid's talking to your adrenal gland, which is talking to the brain, your stress response hormones and the adrenal cortex, and then talking to what produces your epinephrine and norepinephrine in the brain. And it's always trying to be in balance. So I have to make sure all of those brain communication hormones are actually in balance in order for you to see a real difference.
That's really
So
that's exciting stuff. And I think
it
it's a big missing piece of the puzzle when it comes to
Yes.
corrections.
Yeah, because it can't be in isolation. I
Yeah.
can't treat your sex hormones.
Yeah.
I need to look at everything else and balance.
All right. The other big topic is stress management. You get a lot of patients that have stress, and how do they handle that? And what are some of the things you do for them?
Interesting with stress is, again, cortisol, which is the stress hormone that gets produced by our adrenal glands. The adrenal glands, remember, sit on top of our kidney. They're kind of little. they work, we need stress, right? Our bodies need some degree of stress. So I always use the analogy, if you look at all of the deer, right? We have a huge deer population in New Jersey. You will see tons of deer relaxing and grazing on your front lawn. All of a sudden, as you're driving by to drive into your driveway and the headlights go on to these deer, they all raise their heads in unison. They have to evaluate, they evaluate really quickly what's going on and whether it's harmful for them or not harmful. Their adrenal glands produce stress hormone and they all run off. And you've seen this a million times. However, once deer realize that it was just your car that was coming into the driveway, they go back to grazing now on your neighbor's lawn where they went. So their stress response does what it's supposed to do. It allows them to run away from a predator, and it allows them to feel as if they can run, right? Because their stress hormones have allowed their oxygen to get delivered to all their extremities to allow them to run. They realize they don't have time to urinate or go to the bathroom or have sex. They can't do any of that. They just need to run. Then their stress hormones go away and they can go back to relaxing. That's the main difference between us and the animal world. We ruminate on our stress. And by that, I mean, we think about what would have happened if, or what's going to happen when, or, is this scenario actually going to happen, or am I thinking of something else in my head that it may go that way versus this way? We spend so much time ruminating that our stress hormones never go back to the relaxation stage.
It's interesting you talk about that with the deer, because in the physical therapy world, we're doing a lot more research in pain neuroscience. And we know that this fight or flight response and the lion entering the room is a big factor in chronic pain.
Correct.
And these people have these elevated cortisol levels, and we're trying to do these things, but until we can get their stress reaction to go down, there's no way to fix the problem. So it's a great analogy that you use with the deer.
The other thing about it is we try to, like, even with our sleep hygiene, because
sleep is important. Yep.
Sleep is so important for cell renewal, for just getting rid of toxins. So we try to teach people to sleep. And I will say that also, it's very stressful for people to turn off their electronics. We want to be answering that last email before we put our head on the pillow. So that whole stress response is huge. So we do a lot with that, and we do a lot with separating what's really happening from what we think is happening. That's cognitive behavioral therapy.
Yep. So, really critical in this approach, I would assume. One of the other topics that you wanted to discuss was this autoimmune thyroiditis. Can you just spend a couple of brief minutes on that?
So autoimmune disease is on the rise here. And so those are type 1 diabetes mellitus, MS is one of those, celiac disease, which you hear about so much now, pernicious anemia, and autoimmune thyroiditis, or low thyroid. That is the biggest autoimmune disease going on in this country. And women to men, it's like 7-1 in terms of how many more women are affected. What we are noticing, and we use in functional medicine a lot of work based on Dr. Fasano, Fasano, his work, where he thinks there's 3 triggers to actually autoimmune disease. And one of them is, was there sort of an inciting event? So was there a trigger? Is there a genetic predisposition? And the last one is gut health. And so I don't know if you've heard about leaky gut. We call it intestinal permeability. But Dr. Fasano's thinking is that we need to start at the gut in order to repair this leaky gut. So what happens is the immune system is mistaking your own thyroid's normal processes as being a foreign invader, and it essentially attacks the thyroid. So we sometimes think of triggering infections as being bacteria, viral infection. Sometimes it's an environmental trigger. So we dig deep to see if we can find something like that. Sometimes we need to use Synthroid or a conventional, it could be Synthroid or a more natural type of thyroid replacement initially, so that our patients feel better while we're uncovering some of these triggers. We do a lot with decreasing inflammation in these patients, which starts at a nutritional level. So it's balance is the key. We need a little bit of inflammation, but not a lot of inflammation. So it's really very eye-opening for my patients. We learned so much about autoimmune disease from celiac disease, right? Those are an inability of a patient, they're born this way, to process gluten, which we see in wheat. We remove the gluten and these patients feel so much better. We removed their trigger. They had this genetic predisposition. We removed the trigger. Their symptoms resolve. So we've learned so much about autoimmunity just looking at celiac disease. So it's one of my favorites, actually.
Yeah. Now, I'm assuming there's some coordination with their general practitioner or their primary care doctor if they come to see you. How does that work?
Yeah. So I always tell my patients, I'm just another member of your healthcare team. I'm like another player on the team. Okay. I love to coordinate with your primary care physician. And actually, I want all of my patients to have a primary care physician, because we do not cover acute emergencies. We do not cover 24/7 care. So I never take somebody off of their Wellbutrin or their lipid medications or their diabetes medications without talking to an internist. I'm not stepping on anyone's toes. I want the lifestyle changes, the good nutrition that we add, the supplements that we add to speak to them, to speak for themselves, so that your physician is like, wow, I've had to lower your blood pressure medication over the last several months. What are you doing? That kind of thing.
Yeah.
But yeah, I want to have a great rapport with your internist.
Great. Now, the last thing is you like to do is called a strategy call. Is this where you get a little introduction with the patient?
Correct.
Briefly explain how that works.
So I want to know how committed you are. I'm really very transparent and letting you know that you didn't get here overnight, and I'm not going to be able to change things overnight. So I get a gauge, I let the patient speak, and I let them give me a mini health story and their big concerns. But then I have to let them know sort of what's required. Now, granted, not everybody is on the same, what do I call, the change spectrum. Not everybody's on the same change spectrum, right? There's some people that are ready to give everything, and there's some people that are sort of unsure. I think I'm a pretty astute clinician. I need to know where you are. So if you're someone where I'm going to say, listen, we're doing small changes to give big impact, or we're going to change everything all at once based on your commitment, I need to be able to gauge that. And to be perfectly honest, I need to set everybody up for success. So that's why we do the strategy call.
Cool. Yeah. Well, thank you so much for coming on today. We learned a lot about integrative and functional medicine.
Great.
And I think hopefully people will follow up and try to see if they can improve their health and longevity through a different approach.
Yeah.
So,
and there's lots of stuff there's a lot of blog information on our website, delnegrointegrativehealth.com. So just take a look.
Great.
Thank you so much, David.
Thanks for joining us on You and Your Health. Until next time, I'm your host, Dr. David Bertone.
Thank you.